Hello and welcome. I'm Joanna Junak and this is GFN News on gfn.tv. Social media has had a significant impact on raising awareness about various health issues. People increasingly turn to social media for information about new health threats and outbreaks of infectious disease. But how has social media influenced public health narratives and responses during two recent health crises: the COVID-19 global pandemic and the panic over e-cigarette or vaping product use-associated lung injury, also known as EVALI. Joining us today to discuss the influence of social media is Gabriel Oke, a public health professional with a background in biomedical science, health communications, data analysis, research, and project management. Hello, Gabriel. It's good to have you on the program. First, can you tell us where the idea of writing this paper came from?
Okay, thank you very much for the opportunity for this call. So I like working at the intersection of research and communications. So most of my projects are actually at the intersection of research and communication. So when I was approached by Chim, I was really excited about it. But why the topic itself? So the topic itself, I was so interested in the topic because during COVID-19, I was part of the COVID-19 misinformation project, whereby we debunk myths, we go online, we go to WhatsApp messages and curate content from what people are discussing, which are myths about COVID-19, which is preventing them from taking the vaccine or just preventing them from, just preserving themselves and preventing COVID-19 spread. So when I got to see the topic, I was really excited because now I can compare that to one of the projects I'm working on at the moment, which is tobacco harm reduction. Yeah, that was why.
And how did social media platforms contribute to the dissemination of information during the COVID-19 pandemic?
Yes. There was a lockdown as well. So people were at home, just less busy. You want to share something, and then WhatsApp status, WhatsApp messages, and then TikTok and some of these other social media platforms were getting prominence as well. So it was just a period whereby a lot of people were out, were out of job, not like resigned or something, but because there was a lockdown, there's a lot of staying back home. So you were with your phone more. You're spending much time on social media. You're spending much time on Facebook. So I feel like that actually caused the whole spreading. And then the fact that with a click, 20 years ago we don't have some of these things. We just a click now. You can send a message to, let's say, a broadcast list of maybe 300 and 350 people. So I feel like it's just like a new normal. The same way we have COVID-19 lockdown as a new normal, then it's just like a new normal now. You can just be on your phone, record the video, and then it just blow up because of the algorithm. And then another thing I feel like is the influential culture, I think I'll call it, whereby you want to gain followers. You want to always be able to speak on what is happening at the moment. So even if you're not a medical personnel or you're not a journalist or something, you still want to speak about what is happening. So I feel like that created so much pressure for people to want to get involved in sharing information.
And how has the situation with media platforms looked during the EVALI scare?
Okay, so for that, because I think the difference between the two is the fact that for COVID-19, that was the population level uh, pandemic, some epidemic in some sense, because everyone was involved. But for Everly, because not everyone, even some people still don't understand the meaning, right? So that one was more of like people that were I feel like people that were involved in epidemics of Everly were more intentional. They were more intentional. They knew what they were doing. They want people to just because a lot of people haven't even heard of Everly, and then maybe the first information they are getting to hear about e-cigarette now is about this epidemic. So I feel like it was more intentional during Everly, and then just a way of trying to affect policy in that sense. So it's more of okay. I mean, e-cigarette I mean, I don't agree with e-cigarettes. So since this thing is against e-cigarettes, I'll push it out there. So I feel like that was the difference. Social demographic level, people that are smoking, people that understand the public health dynamics of smoking and tobacco harm reduction. People, I think those are the people that are involved with Everly as well. So it was more intentional in that sense.
So, how did misinformation on social media platforms affect public perception and policy decisions during the Ivali scare?
Okay, so for the lung injury epidemic, as I said earlier, it's not like that of COVID. COVID is more of a breathing space of information and a catalyst. But now, because the whole tobacco harm reduction, smoking cessation discussion are very sensitive. So it's more of like an agenda. Yeah, I think that's the word. It's more of an agenda driven. Yeah, I think I'll put it like that. That the old Everly, um, you know, the old Everly part of the whole mix of the paper I wrote. It's more like, okay, I want to really drive an agenda with this. I want this. I want more countries to be against these e-cigarettes. It was more of well thought out, uh, process. For people to say people who are involved in that social messaging, intentionally resharing, because you just want the policymakers, you just want the policymaker, people that are involved in policy, to be pressured in some say, oh, I mean, people are talking about this. I mean, because I think during that time, someone told me that the only thing she knows about, and she's a very influential person, that the whole thing she know about e-cigarettes is that it's caused this, it's caused that, it's caused. I mean, you can understand that programming. You can understand that programming that it's not holistic. So there's no positive and negative. Because for you to really understand something, you have to hear from both sides. So now, because social media is good, right? Okay, I'll use it for my agenda, and then you keep pushing, you keep pushing. It was more agenda driven. Yeah.
What strategies have been implemented to fight misinformation and promote evidence based approaches in public health initiatives?
Okay, so I think I was involved during COVID with one. So what we did was that we got a funded project whereby we were able to create animation videos, we were able to create interview. So we were able to interview because during COVID-19, what happened during COVID-19 was because people lost trust in the government, right? To be able to now interview government officials to speak their mind, let people understand where you are coming from. Why are people not seeing people that are dying from COVID-19 or suffering from COVID-19 on the TV screen, on their television? So when you're able to express yourself as a leader, then that kind of gives some story. Okay, they may not be showing us this, but at least they will explain themselves. So that was an approach, kind of interviewing and engaging those key leaders in the community as well. And then people that can drive, because when you're driving misinformation intentionally, it's an agenda, right? So intentionally now driving the right information. So you are looking at maybe the lead of market women. I think there was a time during COVID where I was told to go and interview a community leader, a king in a community, just to because the king is always supporting COVID-19 vaccine programs and the like. Let's understand, why are you supporting COVID-19 programs as a leader, and some other people are not supporting? What do you think people can do differently? And then how do you think they should think about this? So I feel like, because we're public health professionals, we're communication experts, we can understand the research, we can understand everything, but these other people, they're coming from a very different place. They're meeting their friends at work. They're seeing they're talking to their wives. They're just coming from a very different perspective. So going into their world and speaking their language, animation videos, radio jingles. I mean, there are a lot of people that listen to radio every morning. So when they listen to these things, and they get to understand, okay, yeah, maybe this is not totally bad, and then they start improving their knowledge, and then the perception will change after a while. So I feel like it's just intentionally driving the right information. We kind of come against the old misinformation. It's like a force, right? To come against the old misinformation force.
And in what ways can cooperation between public health agencies, technology companies, and communities enhance the management of online stories during health crises?
Yes, yes. I think Everly, we still have to do a lot as advocates, as researchers, and as scientists. We still have a lot to do with Everly. But during COVID, I remember something during COVID whereby every website you get to, you see something on COVID-19 at the top of the website, right? Yes. And then I think there was a chat bot or maybe a WhatsApp chatbot for WHO on WhatsApp as well. So I mean, the world is going techie, the world is going AI at the moment. It's just the new normal. You can't do without AI. You go to the airport, you go online. So I feel like it's just being intentional in creating artificial intelligence and creating digital solutions, that people use in their normal day life, but adding that sort of knowledge, that tool that make them to understand, because you don't want things to go so awry, like so negative, before you now start preventing. So there's a way you can actually prevent with the right information on time, so that we can so that you don't get to now be treatment and all that. So I feel like, yes, maybe creating more WhatsApp chatbots as advocates, as societies that are advocating for tobacco reduction, trying to share the right information on maybe WhatsApp groups, and then social media platforms where people are always going to, and then if there are enough funding as well to fund ads, because ads are always coming to your faces now. When you go to a website, you get to see some ads and all. So when some of these are right information about a very, very important aspect of public health, smoking, how many people are smoking? Well, like, it's a big thing. It's just that we don't get to talk about it enough, right? It's a big thing. So when we have enough support in that area as well, to say, okay, yes, we have this public health concern as well. I mean, this is how you should prevent it. This is how you should talk about it, and this is how we can go ahead as public health practitioners. So I mean, just being intentional in putting those new tech tools, new tech method into adding those features to what is already existing in some sense. Yeah, thank you.
Thank you, Gabriel. That's all for today. Tune in next time here on GFN TV or on our podcast. You can also find transcriptions of each episode on the GFN TV website. Thanks for watching or listening. See you next time.